Good afternoon, I'm Dr. Robert Mitchell. Today we're going to demonstrate how to prepare an intramuscular injection. This is an intramuscular testosterone injection. In your order, you should have received a box with medical supplies for injection, alcohol swabs, vial of testosterone. This box may be different for your order of testosterone. It will be exactly the same medication, but don't be alarmed if the color is different. It will differ based on the drug manufacturer that the pharmacy has sent to you. And this is a vial that's already been opened. When you receive your medication, this vial will come with a plastic cap that is a pharmaceutical seal. Once you receive this, you can just pull the plastic cap off. And for this demonstration, we're going to go through how to load the syringe for an intramuscular injection. And so each and every time we'd like for you to start by washing your hands first, and I have for this demonstration. These alcohol swabs that are provided in your box, we just want to clean the surface top, which this is a rubber plunger that we place the needle through, so that's nice and sterile and clean and ready to load that medication. You will receive 1 cc syringes, and they will look a lot like these. Each of these syringes are calibrated from 0.1 mil all the way up to 1.0 mil or 1 cc. There are 2 types of needles, 2 sizes. For all, whether it's subcutaneous or intramuscular, we use a larger needle for drawing up the medication. It's typically an 18 gauge needle. It's easier to draw up the medication with this size needle. So now that we have our needle placed on the syringe and ready to load our medication, the plunger has been sterilized with alcohol. So what I'd like to do is I first like to start with about 0.2 mils or cc's of air in the syringe. I'd like for you to puncture the plunger like this. Then place the vial upside down so that the medication is all in this position. Push the 0.2 cc's of air into the vial and then slowly pull this plunger back. For today's demonstration, we're going to be preparing a 0.5 cc injection. So as you see that we're at the 0.5, but we still have air here, I generally pull this back to about a 0.7. The air is still located because of the position at the top. I tap on the syringe to get rid of any air bubbles that might be in this position. Slowly push this out to 0.5 mils. Remove the vial of testosterone. We can remove this needle now. And for today's intramuscular injection, we're going to be placing the actual needle that we use for intramuscular injection. For those of you that have used subcutaneous and intramuscular, this needle for intramuscular is about the same size essentially, but it's going to be a little bit longer to get into the intramuscular tissue. And so again, we've loaded a 0.5 mil testosterone dose, now suitable and ready for an intramuscular injection.